Dr. Diaz from MaineGeneral, the Chief Medical Officer.
We are prepared for this. We want people to understand that we will have a plan that they can adopt, and that we understand as healthcare professionals that anxiety is part of the reaction, and we want to reassure people that we can't control everything, but we will have plans, and they'll be transparent, and that's what we'd like to do. The hand sanitizer question.
Yeah, that was interesting. Have we reduced our ability to reject these viruses and bacteria?
We have not, based on hand sanitizers. The human species is very interesting. We're very adaptable. We're very mature as far as our immune systems. The hand sanitizer isn't going to affect how you fight infections. One thing that is important to remember is that hand sanitizer is not for every infectious disease. For viruses, it does work. There's other infections that we've had in the past where we've said you need to wash your hands with soap and water, which is still the gold standard. Sing happy birthday 20 seconds. Don't touch your nose.
People in nursing homes or hospitals visiting, what should we do there?
Yeah, So the first step is everybody is screening visitors. We have actually good collaboration between all the health systems. We talk once a week on this, trying to get ahead of it. Everybody is doing some sort of screening or limiting of visitors appropriately in order to stem the spread amongst patients and others. If you have someone in a nursing home and you're more concerned because of what happened in Washington, bringing them home, it's an individual decision. The hard part of nursing home patients, and I'm sure you're aware of this, is they have different staffing models and they're cohorted differently than hospitals because they have a lower level of acute disease. But they're also, many of them have significant comorbid conditions, medical issues that are chronic that make them at higher risk. So when I think of acute care hospitalizations, that those patients are sick, usually the idea is that they will get better. But in nursing homes, it is more insidious. That's a great word for this morning, in that people are chronically ill, a little bit older. And again, they're closer to each other. And if you don't control the visitors, that will be a major issue. And I think you'll have what happened in Washington happen elsewhere. Hopefully we get in front of that.
Dr. Stephen Diaz, he's the Chief Medical Officer for MaineGeneral. And he's been gracious enough to join us this morning to try to calm some fears, get to some facts here, and give us the state of coronavirus, COVID-19, in the state of Maine. Let's start with that presumptive case, meaning that it hasn't been confirmed by the CDC in Atlanta, but we have a test facility in Maine. I think the legislature approved that $58,000 machine device to test for COVID, a wise investment. Allows us to get results more quickly. Desiree has concerns about the method of the testing.
I mean, where?
What's the sample?
How is it invasive? What do I got to do? I'm afraid to have a test. The machine was $58,000.
He's clutching his chest over here.
So the test is a swab from your nasal passage in the back of your throat, and it goes into the same collection tube, and we send it to the lab, the state lab.
How do you send it?
In a vial. It's in a sealed envelope in a sealed vial.
As you'd send
where's the
blood
envelope?
or other
Is
samples,
the envelope
right?
in like one of those
I see
bulletproof
what you're saying.
briefcases, and does it have armed guards?
Does it get any extra care than a regular sample of other fluids?
We actually do viral testing a lot. So the flu swab, other infectious disease virus swabs, RSV, which is respiratory syncytial virus, same kind of process. The difference, of course, is this is a new test, new reagents, new machine. So it goes to CDC, Maine CDC, which again is consistent with other laboratory tests that only they do in Maine. There's a whole slew of infections that they want to know about if we were to diagnose one, and they do the confirmatory testing. So that process is well oiled. And then it's preliminary, and then the swab then goes to national CDC for confirmation to make sure that the screening test is correct. The good question, though, is what happens to the patient?
Well, in the meantime, is she sitting in a chair waiting for her results? Or
it depends on how ill they are. So if someone has cold symptoms, mild to moderate, they're able to breathe, they don't feel good, but their vital signs are fine, that person should stay home. Chicken soup, water, watch your favorite streaming system, a little bit of Tylenol. And then if you get worse, give your doctor a call for advice. If you can't breathe, if you're really calamitous, if you're, especially those who are older or with other comorbid diseases.
And that's a small percentage, though, right?
That is a small percentage.
Because it's 80% plus that have mild symptoms.
Correct. And very small percentage get really ill, at least right now in the U.S. And those people will need hospitalization if they need oxygen or IV fluid or other breathing support. So it depends on the severity of symptoms, depending where you will be while you're waiting for your test results and for the virus to run its course.
May I ask how MaineGeneral is equipped to deal with hospitalization?
Every hospital, including Maine General, we have personal protective equipment, training and devices, certain masks, certain way we gown. It's all prescribed by the CDC. We train on it. Every year you have to train on it, so it's consistent, and we're doing updates now given the COVID-19. We are fortunate that all our hospital rooms at Maine General are private. We don't have any shared rooms, and so we can
that's nice.
we can cohort patients in a wing and keep them together. And
I can eat all the ice cream I want, baby.
That's right. You can order off the menu at Maine General, so it's also another bonus.
Awesome.
But yes, so it depends on the severity of illness that the patient has, depending where they will be. And then if they do need hospitalization, we have special ways that we take care of them, as with other people with airborne precautions who might have other diseases as well. So,
how many test kits are available, and does Maine General have test kits for Central Maine?
yes, everybody was given test kits. It's sort of a moving target right now. Initially, when the national CDC rolled out testing, if you remember, they kept it under their own banner.
Right.
Typically, they would rely on other partners to co-develop testing. They didn't do it this time, which put us behind the 8 ball. I did hear Anthony Fauci earlier this week say that the U.S. has 4 million test kits right now and expect more next week. I think right now we're okay. It's a day-by-day moving target, as it is with the N95 mask, which is one of the respirator masks we use, and other personal protective equipment. Everybody has plenty today, but depending on what happens with the number of cases will depend on what happens to that resource.
And that's why flattening the curve is an
so
important measure. Yeah.
Yes.
Wow.
So what is the turnaround time on these tests that you administer?
So for the state of Maine, it's a 48-hour turnaround for their screening test. And for the confirmatory test from Atlanta, it's 5 days, 4 to 5 days.
And 14 days is still the recommended self-quarantine
Yes,
period?
self-quarantine if you're at high risk and or have symptoms, it's
14 days from the first time you felt a symptom or from your test?
So it's a bundle of things. Let me go through each one individually. So let's say you're on a bus from New Jersey to Portland, and it turns out somebody on the bus had COVID-19, and you didn't know about it, but the CDC knocks on your door and say, were you on this bus? Yes. Well,
that was my question. What happens? What does the CDC do once you test positive?
They have epidemiologists who interview the patient and figure out all their contacts. And I don't know how far back they're going for this epidemic, but they get all their contacts and they contact them. And the recommendation is self-quarantine. If you're feeling fine, that's great, but you should stay home for 14 days. If you're ill, you should get a test so we know whether or not you rule in or out to know how that works, but you should still self-quarantine. And if you feel ill and you do have COVID-19, you need to stay home, or if you're ill enough, you need to come to the hospital.
So that's an important criterion when you're being when you're requesting a test kit. Is that did you have exposure to somebody?
Yeah, of course.
And were you out of the country? Does that remain the same? Is that the same criteria as it was just a week ago?
That is one of the daily changing criteria. So if you look at the heat map for COVID-19 today, you'll notice a lot of U.S. hotspots.
Mm-hmm.
So travel from other countries for which it is an epidemic currently is definitely something to be screened for. Yet I think you're going to see that if people come from states in the U.S. or air travel, that might place them at higher risk in today that we'll need to figure out over the next few days.
If you're a person that suffers with some sort of lung disease, you have an issue with your lungs, and you have a vacation planned, let's say to Florida or California, somewhere nice and hot and on a plane, would you recommend postponing that trip, or would you say, you know what, do it?
Yep. So I have lots of friends who've asked me that same question over the last 48 hours.
Yeah.
They have trips planned here, there, and I've recommended they all postpone their trips. The cohorting of people on planes, I think you'll find as one of the vectors for increasing cases. Right now, the best thing to do is stay local, stay close to your home. Let this play itself out. Hopefully we bend that curve and flatten it so that there aren't as many cases as would be predicted, and that would be good. And then at some point, in the next couple months, the CDC smart people will know how to advise us, given whether it's burned itself out or not, and or if there's medicines that could help or vaccines. So we don't know a lot that we need to know in 2 months, but right now I'm recommending people don't travel.
Dr. Diaz, Chief Medical Officer of Maine General. The questions that keep coming in are about the impact to the economy. And I know you're not an economist. You are somebody who is trying to protect the well-being of Mainers. But there's a tipping point, isn't there?
Yes, there is.
And with our response to this, A lot of folks are concerned who work for small businesses, restaurants. We are seeing concerts, cultural events canceled on a mass scale here.
Yeah.
The ripple effect is going to be tremendous, even in just 30 days. I talked to a lawmaker yesterday who felt tens of millions of dollars, perhaps over $100 million could be the impact in the short term here to the state of Maine with a small economy, in a really tenuous economy that it is right now. Are we doing our best to balance our response to the crisis and with an eye toward what the impact will be long term?
I've heard the same thing. I've talked to many people who are small business owners, and that is a real issue. Unfortunately, if we're successful in bending the curve and we limit the number of cases in Maine, people might say, look, you overreacted because we didn't have what you thought was going to happen.
Mm-hmm.
And if we don't have it because we did a good job, you don't get credit for that.
Mm-hmm.
On the other hand, and I'm not trying to be dramatic, but how do you value a human life?
Exactly.
What if it's your mother, your father, your brother, your sister?
That would change
child.
people's perspective
I mean,
on it.
So perspective. So as a physician, my perspective, I could have many lenses, but my lens that I'm using is mine as a healthcare professional. Right now, the right answer is to the public health measure of social distancing and all the good hygiene measures that you need to do to stop the spread of the disease.
Boy, you've enlightened us so much, Dr. Diaz. You brought
Honestly.
calm. You've brought facts. You've provided some information here that I hope will give people a lot of hope that just because it seems like life is upended and our reality has been shifted here, that we are doing the right things and we're in a good position to see our way through this thing.
Yes, and thanks for having me. I do think that the best thing you can do is to follow the advice of your healthcare professionals. You know, if you have concerns, ask your doctor. But the only way to get ahead of this is public health measures. Once it's here in spades, the horse is out of the barn. It'd be too late.
Before you go, can you give us any kind of timeline?
The problem is we don't yet know the slope of the curve in Maine. So now, and even nationally, it's still evolving.
Right.
I tell people it's a day-by-day discussion. I think in 2 weeks, we'll have a much better handle on what it means for Maine and what it means for New England. That'll drive a lot of decision-making then going forward.
Mm-hmm.
I just think right now, today, it's too early to know the total impact, and what we can do best, as being repetitive, is to take care of yourself, take care of your family, don't gather in large groups, and eat healthy, stay healthy, all those good things.
Dr. Diaz, Maine General, a pleasure. Thank you so much for the visit and the information.
Thank you very much.